they get it. So that's, it's, again, it's a battle, but it needs to happen. And another question for Flavia, maybe, as a journalist, are you able to get community insights or hear what people are saying on the ground, and then working the public health officials? Do you tell the public officials what you're hearing on the ground? Okay, some of the hesitancy, the misunderstanding, the misinformation, how are you able to communicate those to the powers that be? How are you sharing the community insights is one of the questions.
Okay, so there is a joke that was circulating here on social media, where someone was saying, Jalen talked about education, and that joke was about a person who was fully vaccinated who died, and then somebody said, the doctor said that the situation could have been worse if they weren't vaccinated, and this person had died. So it comes back to being informed that you will get COVID anyway. You might die even if you're vaccinated, because it can happen. You never know. You had COVID, but you're dying of another predisposing factor. So about the link between us, the community, and the powers that be, the Ministry of Health and the managers of the pandemic, what has been happening down here is increased engagement, because there is a weekly update where the ministry engages with the journalists. So there has been more contact between the journalists and the policymakers and the Ministry of Health, telling them what is happening in the communities. Again, there has also been an increased number of studies. A lot of researchers have picked interest in COVID-19, because a lot hasn't been known about the disease. So whatever they find and whatever we see in the field, we try to put it to them. We've joined a lot of WhatsApp groups with doctors on the task force. They formed a task force here where people working directly as frontliners in the COVID-19 area, you are able to access them more quickly than it used to be, because really, like I said before, that before this pandemic, it was a hassle. It was quite hard for you to access a doctor. There was all these restrictions. If you need somebody in the government institution, you have to go through the PRO. Those kinds of things are getting broken. And I think that would be the good thing that we have got from this pandemic, that now scientists are more easily made to speak about issues, and you can access them with myself. I have many times called the executive director of the Uganda Virus Research Institute. That's the institute that initially was testing, and now they are doing sequencing, and they are doing a lot of HIV related COVID-19. I do a lot of HIV, so COVID-19, sorry. So they are available to answer the questions, and if you make use of them and you make them realize that you are a person who will present their facts the way they are, you will not distort, you will not be alarmist. One of the problems we have as journalists, we want to excite the public, and this really doesn't work for science. So once you develop that relationship with scientists, I think it's easy for you to link what is happening in the community and then putting it to them to get solutions.
Yeah.
Yes, Helen.
I agree. So as we are wrapping up this, first part of the session, one of the comments that Charles mentioned is the hesitancy towards the vaccine and major problem and a very huge hurdle to cross, especially in countries like Nigeria, where we have been fortunate not to experience the COVID level as higher as maybe some European countries or even in the US. And I see this also in Ethiopia. But what we're not realizing is I guess our community is not understanding is how, I may be a healthy 21-year-old or a healthy 25-year-old, but I may have a mother that's immune compromised at home or may have pre-existing condition. And it may not impact me if I get COVID, it might go away as a flu. But really, like I said, the education process is, okay, I bring it home. And so that impacts my mother, or that impacts my grandmother or my father or whatever. So, again, this is really like a big an awareness. Like you said, it's awareness. So thank you, Jolene and Flavia. We're going to go to our next panel. Rebecca, unless you have something to add before we move to the next session.
No, thank you. Thank you for that fantastic panel. And I see the great chat with questions and responses to the chat. And Dr. Ayu, thank you for contributing to the responses on the chat. We're going next to the poll. So the poll should be up. Jamie, I see it on my screen, but I see in the chat people asking, where's the poll? So we're going to take a few minutes for people to complete the poll as we transition now to the next panel session. So I turn it back to you, Helen, to introduce the next panelists, and they each have about 5 to 7 minutes to talk about their work before Helen does the questions. So back to you, Helen.
All right.
And Jamie, the poll, I see it up on my screen, but people are inquiring about how to get to it.
All right, so our next panelists are Mr. Michael Haney, Senior President and CEO of Global Training Centers. Michael has devoted his entire career to the lodging and hospitality industry. He's held various positions before rising through the ranks of the executive level position. He has held for the last 40 years. So many years of experience in the hospitality industry. He founded the Maryland Center for Hospitality Training back in 2012. Currently he serves as the president of Global Training Centers, LLC, a Florida company devoted to training initiatives, workforce development, and serving all industries. So I'm going to ask Michael to tell us a little bit about himself when we get there. And then our second panelist is Ms. Eiko Boyo. She's an actor, producer, creative entrepreneur, and founder and managing director of Temple Production. So welcome to both of you. Michael, if you could tell us, I briefly said a little bit about your background. If you can just tell us a little bit about yourself, that would be great.
Hey, thank you very much, Helen. It is a pleasure to be here. Good morning, good afternoon, good evening to all of you around the world. I think you said it all, Helen, relative to me, but what I would love to talk about is the past year and a half during the pandemic and my ability to travel, particularly to Africa. And I actually asked that there be some imagery shown of the faces of our industry, particularly in Africa, which I had a chance to visit, to investigate and see the opportunity not only to do business, but to see how they were faring during the course of the pandemic. And I did a couple of informal polls, which I'll talk about during the course of that. But, in order for us to get our massive tourism industry restarted, it's important the success of the COVID-19 vaccination campaign. Let me say that first and foremost. I would not have felt comfortable traveling if I had not been fully vaccinated. Matter of fact, I chased it down. I went to Florida from Baltimore to get a vaccine shot because some of the requirements they have, because, I'm only 28 years old. And so I had to, oh, you guys don't believe me. So I'm only 28 years old and they had this age requirement. So I felt the need to get on the plane and go and get vaccinated, because that was important for me in order to be able to travel. And I've been on a plane, I believe, 67 times since last August. And I wanted to make sure that I was comfortable in doing so, in addition to over 75 room nights in the hotel. And we'll talk about those particular issues relative to climate and environment during COVID and some of the good practices that have come out of it. But back to my trip to Africa, particularly Kenya and Uganda, and being able to interface with hotel workers who are affected, retail workers who are affected, security officers who are affected, people that worked at golf courses that were affected. And, the good thing over there is that they understand the need to get the industry back, and it is incumbent that people from all over the world are able to travel, because tourism is very important to the continent of Africa. And people's ability to travel from Italy, people's ability to travel from the US is incumbent on their attitudes and ability to make them feel comfortable. At that point that I was over there in June, vaccination was not widespread, which it's a bit more now. And my informal poll showed that over 90% were very interested and willing in being vaccinated, which is important because they understand that there's a social contract that we have. you know, that we have the ability to ensure that not only are we safe, but that if people come into our environment via hotel or restaurant, that we have done everything possible to ensure that they're safe as well. So it's not just about me not being vaccinated and maybe getting influenced by COVID and spreading it to my mom or to a customer, to a guest. And it goes back to that social contract that I spoke about earlier. You know, I think that where we are now, if I can just say in wrapping up, is that there has to be a mandate among employers to ensure that information is conveyed to their employees properly and that employees understand the necessity of ensuring that their guests are safe, that in addition to understanding the cleanliness and hygiene aspect, which we initially were dealing with during COVID, hand sanitizing, wet mask wearing, social distancing, that now we're at another platform of ensuring that vaccination is important. So I think that employers have a relative role. Global companies like Marriott, McDonald's have a global role in ensuring that their employees are aware of information that is factual, and even to the point, be it incentive or be it mandated, that they are vaccinated. I know in New York, for instance, in the US, some companies have gone as far as saying that if you're a guest, you can't come in unless you can prove vaccination as well. So Helen, thank you very much for sharing. I appreciate you sharing the beautiful pictures of these beautiful people and entities that I interacted over in Africa, and I look forward to any comments or questions that people may have. Thank you.
Okay, thank you, Michael. We'll come back to the impact of COVID and the hospitality industry and where we see it moving forward. Ms. Ego, are you on the line?
Yeah, Ms. Boyer is on the line, but she's on a phone because she has internet challenges.
Oh, okay.
Boyer.
So should I still go ahead and ask the question?
Please go ahead. Yeah, please go ahead and ask your question.
Okay, wonderful.
On the line.
All right. So, Ms. Ego, I wanted to ask, as an entertainer, as a media personality, what do you think is the role of media from even TV and, you know, movie standpoint, the role of media in, you know, misspelling the vaccine hesitancy? Where do you see your role in that? I think she might be on mute.
Yeah.
Hello, sorry. The